injuries, and risky behaviors. The mental health disorders experienced by adolescents are depression, anxiety, and self-harm. And then also there's unintentional injuries, road traffic injuries. That also is the second cause of illness and disability in adolescents. They are also prone to nutritional problems, that is malnutrition, iron deficiency, and anemia. And then they are also prone to sexual and reproductive health issues such as STIs and unplanned or unintended pregnancies and its complications. You know, at that stage when they are
Madam,
pregnant.
please check the screen for us.
Why? You cannot see the screen.
It's very faint. Yeah, it's very, very faint.
I have an issue. That is why I have shown it.
Okay, sorry.
This way. That is why I was sharing and then re-sharing again. I have an issue. So you cannot see the screen at all.
Yes.
Madam, we can see, but it's small. We cannot see the words.
We cannot see the words. Don't say we can see. Say you can.
We cannot see the words at all, madam.
Please, let's manage it, madam, please.
Because if I exit it, I might not be able to share it again. I'm having challenges sharing the screen. That is why at the initial stage, I was sharing and re-sharing and re-sharing. I wasn't even seeing it myself, but I've managed to see it. So let's manage.
Yes, please, let's manage this.
Yes.
Exactly. Yes, please.
Okay, thank you for understanding. So I was saying, I was talking about the causes of illness and disability, and I said that causes of illness and disability in adolescents are usually not infectious diseases, but they are related to mental health condition, injuries, and then risky behaviors. So I'm taking you through some of the causes of illness and disability in adolescents. And then the first one is mental health disorders. They are faced with depression, anxiety, and self-harm. And then also we have unintentional injuries like road traffic injuries, nutritional problems such as malnutrition, iron deficiency, anemia. And then also they are prone to sexual and reproductive health issues such as STI and unplanned pregnancy. And then the last one is chronic condition and risk factors such as substance use, alcohol, tobacco, drugs, and asthma. So these things I took you through are the causes of illness and injuries in adolescents. But today we'll be focusing more on the mental health disorders. Okay, so let's look at the global statistics of death in adolescents according to World Health Organization. We have top 5 causes of death in adolescents aged 10 to 19. And the number 1 is road traffic accidents. According to the statistics, I'm having feedback. Is someone showing the video? Portia, please mute yourself. Okay. So the first cause of death or the leading cause of death in adolescents is road traffic accidents. Why road traffic accidents? Is due to risk-taking behaviors such as overspeeding, no helmet or seat belt, peer influence, inexperience, and alcohol and drug use. We're all in Ghana when we heard about a pastor whose son was driving, I think, through the Spintex Road, or I have forgotten the site in Accra, and then he crashed in a car, and then I think 3 people died in that accident. So we know his age, he's adolescent, and at that time, when they get access to these things, they will use it without thinking about the consequence. And then the second leading cause of death in adolescents is suicide. And under the suicide, they are faced with depression, anxiety, bullying by friends, and then family conflicts, academic pressure, and impulsivity. So all these conditions predispose them to commit suicide, because if they are depressed and they are not able to manage it well, it will lead to suicide. And the third cause of death is interpersonal violence. That is peer violence, gangs, bullying, access to weapons, and unsafe environments. This interpersonal violence can also lead to death. So it's the third cause of death in adolescents. And we have lower respiratory tract infection with regards to poor health care access, malnutrition, weak immunity, and environmental pollutions. It predisposes them to lower respiratory tract infection. And the last one is drowning. They swim in unsafe places. There is lack of supervision most of the time and no swimming skills, but they want to still swim. And risk-taking behaviors can also lead to drowning. So drowning is the fifth cause of death in adolescents.
Madam, please, we can't see the screen well.
And that is a challenge I am having. So we will have to manage it like that. Okay.
Okay, thank you.
Welcome. So let's look at why adolescent is prone to mental health conditions. At that time, the brain is still developing. The adolescent brain is maturing. Particularly, we have the prefrontal cortex in the brain, and this prefrontal cortex is responsible for decision making, impulse control, and emotional regulation. And this is the time the prefrontal cortex is developing. So they are not able to manage emotions very well. And then hormonal changes. Puberty triggers significant hormonal shifts that can affect mood and behavior. And then also identity formation and psychological stress. At that time, they are now forming their identity. And as they are trying to understand their purpose and values and sexuality and other things, they can be overwhelmed with situations, and then it can predispose them to mental health condition. We also have social pressures, like if there's increased pressure on the adolescent to succeed academically, it can also predispose them to mental health condition. Fear of failure, peer rejection, or not fitting in can lead to stress, social anxiety, or low self-esteem. Let me try and see if this will work. Is the screen better? Or still?
Yes, madam, it's better now.
Now you can see.
Please, still, we can't see.
We
can.
I have increased the size. I've put it to presenter's view, and you cannot see.
This is blur. It's blur.
Madam, please, let's manage it.
Okay. So let's manage
we are
it.
managing, we are begging that right after the class, you give us the slides so that it will also help us to understand and then know what you taught us. Thank you.
Yes, it's true.
You can, who is saying it is true. You have come for the lectures, you will not put anything down, and you are waiting for slides. You cannot listen and then be making your own notes. You are there waiting for slides. The slides might never come. Yes, someone is supporting. Yes, it's true. So I don't know that you will need slides. I don't know that. You can be making your own notes whilst the lecture is going on. I told you the first time I met you that you shouldn't expect the slides. Even if I will give you something, it's a summary of what I've taught so far. It's not the complete thing that I am showing. So you can also be making notes yourself. Let's continue. I'm still on why adolescent is prone to mental health conditions. We have family and environmental factors, factors such as family conflict, divorce, abuse, neglect, or high expectations can contribute to mental health struggles.
Is it only my side? I can't hear anything again.
It's not only you.
Okay, so please, sorry, I think I accidentally muted myself. So on the issue of the slides, you know, some of you students will not come to class. They will not follow whatever I am teaching, and then they are going to rely on the slides. So you would get some slides, but I will have to teach to some points before I will combine it. And then also, I am expecting you to be jotting some of the information that will let me know that you are following what I'm teaching you. Some of you will not follow, you'll be doing your own things, and then you'll be waiting for the slides. The notes will come in a Word form, not as PowerPoint, but I need to teach to some point before I can forward that to you. So what you have already been writing and jotting, you can be reading that till I send what I have for you. Okay. So we have certain family and environmental factors, such as family conflict, divorce, abuse, neglect, or high expectations. And all these can contribute to mental health struggles. And also, if there's poverty or lack of access to support the adolescents, it can predispose them to mental health condition. We also have trauma and adverse childhood experiences. If the child was subjected to some traumatic or adverse childhood experiences such as abuse and loss of a loved one, exposure to violence, all this can lead to mental health conditions. And then we have genetic and biological predisposition. A family history of mental illness can increase susceptibility. Certain mental health disorders have hereditary components. Example, bipolar disorders, schizophrenia, and the rest. We also have stigma and lack of support. Adolescents may feel ashamed to talk about their mental health issues due to stigma. So when the problem starts, they find it difficult to seek for solutions. And also there's lack of access to professional support or mental health education. So when there's a problem, there's delay in intervention, and this can predispose them to mental health conditions. Okay, so we are going to look at the specifics. Let's look at depression. Depression is a serious mental health condition marked by persistent feeling of sadness, loss of interest, and a low mood that significantly interfere with daily life. So with mental conditions, with the depression, normally it's bound by feeling of sadness, but we all can become sad at one point or the other. There can be loss of interest, or we can have low mood, which is normal. But with depression, there is persistent feeling of sadness, loss of interest, and low mood. And this one significantly interferes with their daily life. So depression is not just sadness. It goes beyond that, because there is also chemical imbalance in the brain if someone is depressed. And this can lead to loss of hope, lethargy, and then general apathy towards life. So they will withdraw from people. There's loss of hope, and they become very slow in everything that they do. Symptoms are often overlooked or passed off as being typical of adolescent turmoil. So we expect that during the development, they have emotional changes and the rest. So because of that, we might think that that's normal process that is making them behave like that. But at times it can be depression. The signs and symptoms of depressions are that under their emotions, they feel sad, moody, or irritable. And they might say that they feel empty. They are not interested in or not enjoying activities that they used to like. And they have angry outbursts that are out of character. They feel worthless and might feel guilty and blame themselves for things. There are some of them that might stop seeing friends or going to social activities. Most of the time, they isolate themselves, and they have negative thoughts that do not go away. Some of these negative thoughts are thoughts about death, hurting or killing themselves. They might say things like, I can't do this anymore. Life is not worth living, and those things. So if we hear those things from them, we should expect that they are depressed. And then some of the physical symptoms they might experience is feeling of tiredness, unmotivated or low in energy. They have changes in appetite and have vague or unexplained physical problems, example, abdominal pains and headache. They also have problems with sleeping, such as insomnia or oversleeping. And with the cognitive aspect, they have trouble concentrating. They have difficulty making decisions and difficulty remembering information. So how are we going to manage someone who is depressed? The first one, we should do assessment. And this assessment will help us determine the personality of the adolescent before the depression. We will do assessment to know the onset and the severity, as well as some triggering factors and relieving factors. With the therapists, we can do counseling. And counseling encourages adolescents to talk about their situation. And it also helps them make decisions and find solutions. We also have psychotherapy, which is also referred to as the talk therapy. And it is usually achieved by talking about thoughts and feelings. It helps them change the way they think about things so that they can better manage problems in different way. In all, this talk therapy help adolescents understand their problems better. We also have cognitive behavioral therapy, which is CBT, cognitive behavioral therapy. And this is a structured psychological treatment that recognizes that the way we think and feel affects the way we behave. So this therapy is aimed at making the adolescent understand that the way he or she is thinking can affect the way they behave. So the patient learns to consciously and deliberately change their way of thinking as a step towards changing the way they feel and behave. We also have the family therapy where the family is brought on board because the adolescent lives with the family and the family is the primary socializing agent. So the family is encouraged to address family conflict because at times when there is conflict in the family, it can affect adolescent development. And there should be improved communication where the adolescent can share experiences and build support. All this is aimed at helping the adolescent to address the problem. We have interpersonal therapy, and this is a type of psychotherapy which is based on the idea that people's way of communication and interaction with others can affect their mental health. So we should let the person withdraw from bad friends because when he continue to be with bad friends, they might influence their mental health status. The goal of management of interpersonal therapy is to help the patient understand how his experiences of social interaction and issues can affect their mental health. And at the end, we can give antidepressant drugs. If all our intervention fails, the person is supposed to take antidepressants, which will help to control and then improve the symptoms. So we are going to look at stress. That is the second mental health conditions that I want us to look at today. Stress is the body's physical and psychological response to a demand, a challenge, or a threat. In that, if there is a threat or there's a challenge now, you can be in a state of stress. And stress is the way the body responds to challenges and get prepared to face them with attention, energy, and strength. For example, if you are going to write an exams now, it is a challenge and it can put you in stress. Or if you want to achieve something and you are not getting, you are unable to achieve that, it can equally put you in stress. So we have the positive stress and the negative stress. So with the positive stress, we call it eustress. And this is a mild, manageable level of stress that pushes a person to perform better. So this eustress motivates and enhances performance. As I said, maybe you are going to write exams, you want to perform better. You can be under stress and at the end, you would pass well. We also have the negative stress, which is distress. And with that one, there's high adrenaline and high cortisol level in the blood. And this leads to illness. So let's look at the effect of stress on the body. There is immune system suppression. That is, cortisol reduces immune cell activity. So there's going to be more infections and then slow in healing because the immune system is suppressed because of cortisol effects. Then on the cardiovascular system, there can be high blood pressure and then high pulse. And this can predispose an individual to hypertension, heart diseases, and stroke. We also have metabolic changes, which will increase blood glucose and then fat storage. And if blood glucose is increased, there's risk of diabetes. And then if there's fat deposition or fat storage, it will lead to obesity in the individual. On the digestive system, it can lead to ulcers, irritable bowel syndrome, and poor appetite. And on the brain and mental health, cortisol damages hippocampus, which is responsible for memory and learning. So it will lead to depression, anxiety, and then insomnia. Let's look at the types of stress. We have acute stress, and then we have chronic stress. The acute stress is short term, and the chronic stress is long term. So the acute stress is the immediate response to a challenge. That one is sudden and then it's for a short term. Example, exam. If you are to write an exam, you can be under stress, which is short term. And then public speaking. There are some of us that when you are given a task to speak in let's say a church or a public, or let's say that you've been asked to give a presentation. There are some of us that will be under pressure and then we will become stressed up. So that one is acute stress. Then we have fight and fright response in the body. It can also be one of the acute stress. If you encounter danger right now, it can lead to acute stress. And then we have the chronic or long-term, which is persistent stress. It means that it has been with the person for a very long time. Example, poverty, family conflict, and academic pressure can lead to chronic stress, and it's more harmful because this stress can lead to depression and anxiety. The causes of stress, we have academic pressure to perform. We have social stress as a result of your interaction with people. They can do things that will put you under stress, like isolation, rejection, and the rest. And then also family problems like conflict, abuse, and other things, denying you from your rights and the things. And then financial issues, which is poverty, can also cause stress. And traumatic events like accidents or sickness or physical or mental abuse can also lead to stress. And drastic change in life, like moving to a new school, can also put stress on the adolescent. When there's poor self-esteem, peer pressure, unhealthy competition among people, then sibling rivalry and poor time management can all cause stress. Let's look at the signs and symptoms of stress, and that we look at the behavioral aspect. The person would not want to see friends or take part in activities they usually enjoy. They might seem nervous or anxious, and also sleep too little or too much. And they refuse to go to school, or they might not be doing well in school. They drink more caffeine products or take over-the-counter painkillers or use alcohol or other drugs. They also behave aggressively and they do not care about their appearance. They will behave differently in their relationship and there's loss of self-esteem. So if this is not managed, it can lead to negative thoughts about oneself, and the person will become sad, angry, anxiety, and there can be guilt. It can affect the person's social relationship And stress, if it is not managed, it will lead to depression. Under the emotional signs and symptoms, they become moody, they feel sad, hopeless, and then they find it hard to relax or switch off, especially from social media. And they get more angry more than usual. On the physical symptoms, it will present as if they are sick. So some will present with headache, shoulder pain, stomach ache, and jaw pain, but they will do lab investigations and they won't identify any problem. The person might not eat well, and then they will lose weight, and they are prone to infections and also have panic attacks. In females, there can be changes in menstruation as well. And on the cognitive signs, there's inability to focus, negative perspective, and poor judgment. So how are we going to manage someone with stress? Self-esteem training is very, very important. And the family can also be brought on board, where the family is supposed to have close relationship with the adolescent. It helps in the recovery process. And then also the family is encouraged to think about each other's viewpoint, experiences, and belief, and they should find a way of supporting each other and solve problems together. The person can also resort to maybe listening to music, dance, movement therapy, or some artwork, which all is referred to as creative therapies. So there are some people that when they are stressed, they will just go to an isolated place, listen to a music, or maybe try to do some art, or maybe dance or move around to see people. It's very important and it helps them to cope with their stress. And this creative therapy is used to help the patient understand, communicate, and express themselves in a new and more positive way, so that it doesn't lead to the negative thinking. So it will help them express themselves in a positive way. The third one I want us to look at is suicide, and suicide is a major public health concern. Once a while, you will hear that someone has committed suicide. Yesterday in the news, I heard someone stating a case that there is a teacher who took care of a nurse, and the nurse completed NTC, and the nurse left him. So he went for a hairdresser, and then he has taken a loan of 50,000 Ghana cedis to open a shop for the lady, and then the lady too has left him. So he just bought petrol, poured it on herself, and set himself ablaze, and then he died. So suicide is not only peculiar to adolescents. Most adults, when they are faced with challenges, they are unable to handle the situation, and then it will lead to suicide. And suicide is the second leading cause of death among adolescents and young adults. And this is linked to mental health disorders, especially depression. So if you don't manage the depression well, it can lead to suicide. And girls often attempt suicide more than boys, but more boys are likely to die from suicide attempts. For our girls, at times, it's just attention. They want attention from either their partner or their family. So they will be threatening them with, I'll kill myself, and yet they will never die. They will not kill themselves. They are afraid of death. But for boys, they will not even tell anybody. They will just do the attempt and then they will succeed. Let's look at the definition of suicide. Suicide is intentional act of taking one's own life. And we have some terms like suicidal ideation. That is, you are having the idea, thought of ending one's life. Then we have the suicidal attempt or suicide attempt. And this one is the act intended to end one life. According to the World Health Organization, 800,000 people die by suicide every year, and is the second leading cause of death among 15 to 29 years old. For every suicide that we encounter, there has been 20 attempts, because most people will attempt, but they will not succeed. Let's look at some suicide. When there's family history of suicide attempts, it can predispose someone to also try it. And then exposure to violence, especially domestic violence. In cases of impulsivity, where the adolescent will act before thinking about the complications, and when the complications or the effects happen, they are unable to address the situation and they can commit suicide on that. We have access to firearms. These things are available. It will predispose them or make it easier for them to harm themselves if there's a little problem. And stressful life events like bullying, trauma, loss of a dear one, or academic failures can also lead to suicide. And then social isolation, rejection and stigma, sexual abuse. There are times that some gang can go and rape one lady, and then if the lady thinks that those guys do not deserve her, she can commit suicide. So rape can also lead to suicide, as well as being abused sexually by your partner. And then feeling of hopelessness, substance abuse like alcohol and drugs, because people act under alcohol and drugs, they act differently. And then when there's broken home, the adolescent do not get the ideal home environment, and it can predispose them to suicide. And chronic illness or pain. We often hear of some adolescents that are sick, always they are sick, they are in pain, they are in the hospital with their parents, so they will sit back and think that they are putting their parents in too much stress. Why don't they end their life and they will be free of pain, and their parents too will be free? Mental health disorders like depression, bipolar disease, and schizophrenia can also lead to suicide. And let's look at warning signs that will let us know if someone is about to commit suicide or not. They might be making statements such as, "I wish I was dead. I won't be a problem for you much longer if we wants to take their life." And there's changes in eating habits. Either they will eat a lot or will not eat at all. Then they neglect their personal appearance. They don't care what they wear to the public. They don't care. They are unkept. And there's symptoms of clinical depression. Then there's loss of interest in previously pleasurable activities. And they give away their possessions because they are planning to kill themselves. But for adolescents, I don't know, they don't have anything to give out. And then also we have frequent or pervasive sadness. and they withdraw from friends and family, and there's difficulty concentrating or decline in the quality of schoolwork. In general, they do not care about anything in this world again, and their mind is preoccupied with dying and death. That is what they are thinking about. Then there's risk-taking behavior. So how are we going to manage suicide? We should restrict access to firearms and ammunition. And these are the methods that people will use, or the means that will help them commit suicide. So we should restrict them things. And then also we should counsel the person. And if the adolescent cannot share his or her problem to the parents, we can let a neutral person come into the picture and help to address the problem. And then we should listen without being judgmental, because if you begin to judge the adolescents, it's going to worsen the suicidal intentions. And we need to reassure them that the problem can be solved and suicide is not a good option. We need to encourage family and community support. And then we need to help or teach the victim how to solve problems or conflict resolution skills. On the prevention and strategies, we need to reduce stigma, because stigma can also lead to these things. And there's the need for early identification, where adolescents is being screened for depression and then substance use, because substance use can predispose them to committing suicide. And then we have the support systems such as counseling, hotlines, and then peer groups. So we need to make counseling sessions available. They need to have a hotline that when they have problems, they can call. And then we can form adolescent groups so that they will share experiences and the rest. And then we have crisis intervention, where we should have emergency mental health service so that if the adolescent is in crisis, it can be managed well. And then we need to restrict access to guns, rifles, poisoning, ropes, belts, high places like high bridges, tall buildings, sharp objects like knife and blade. So these are the things that they use to commit suicide. So it shouldn't be available at the disposal of adolescents. And then also there should be programs to
Yes,
strengthen
ma'am.
the ties between adolescents and their families.
Yes, ma'am.
Yes, please.
Hello, sorry. Please, we are complaining of the visibility of the slide. But Regina, I don't know whether you've given your phone to your son or daughter and you are drawing or you are writing plenty on the screen. It is making us difficult for us to see, please.
I have also seen that. I don't know if it is intentional or what, because it is also blocking my view, but she keeps writing on the screen. So if someone can get in touch with her, it is distracting all of us. Thank you for your concern.
Thank you, ma'am.
Okay. Okay, so let's continue. I was talking about the things that adolescents or even adults use to commit suicide. We should restrict access to those things, and programs to strengthen the ties between adolescents and their families is very important. So we are moving on to look at substance abuse. And we know that adolescence is critical stage of growth and experimentation. They are curious, and at that stage, there's peer influence and then also stress. So this makes adolescents vulnerable to substance use. And substance abuse is the harmful or hazardous use of psychoactive substances such as alcohol, drugs, and tobacco. Many adolescents experiment with tobacco, alcohol, and other substances, and they might do this for different reasons. The use of tobacco, alcohol, and other substances can lead to negative health consequences, both during adolescence and into adulthood. Substance use among adolescents ranges from experimentation to severe substance use disorder. When they are starting at the initial stage, they are experimenting it. They want to try it and see how the feeling is like. So they will be experimenting it, and then it becomes a disorder that they cannot stop taking the drugs. Substance likely to be abused by adolescents include tobacco, alcohol, illegal and prescription drugs, the petadine, and the rest. I had a mate from NTC, and then she gave birth through CS. So they gave her petadine for the pain. And then after she was discharged, she went home, and anytime there's small pain, she will be injecting the petadine. And unfortunately, she became addicted, and it affected her very well. That at the ward, when they write petadine for a patient, she will quickly go and remove the petadine. She was injecting herself here and there. So it got to a time that it affected the work, and they sent her to OPD just to be given health talk. And even for the health talk, at times, she will be standing giving health talk, and then she will doze off. So they suspended her for some time, and then eventually she was sacked. She was at Komfo Anokye, she was sacked. So she was home, and then she started begging money and the rest. Finally, she was shot dead, because when you do drugs, these things comes with attack and some issues. So she was shot dead, and it was unfortunate. So her own, it did not start in the adolescent period, but it's because of the CS that predisposed her to that. Let's look at certain risk and predisposing factors why people or adolescents will abuse certain substances: desire for new experiences and an attempt to deal with problems or perform better in school. I have heard that when people abuse these substances, they perform better, but is it true? Do we have an experience, or have we heard about that? Is it true?
Sometimes.
Yes, it can.
Not
Sometimes.
in all cases.
But well, I around, I think 2006, I was at Anchor for 2006 for my psychiatry affiliation, and then when we went there, I think there was a guy who was in the, was it a medical school or pharmacy? He was doing one of those things, and then he was always with books, reading the books, and we were told that he was in school, but he used to do drugs, and then he's intelligent and the rest. So we were asking that, is it the drugs that made him intelligent or not, or what? Because people believe that when you take drugs, you become more intelligent and perform better in school. But drugs can also have effects on your mentality. So it's going to affect your academics as well. Also, peer pressure to fit in with friends. You have friends that you want to fit in with them, and when they are doing drugs, they can also lure you into that so that you belong to them. And then the availability of these substances everywhere. Family conflicts, violent, physical or emotional abuse, and then poor supervision on the adolescent can predispose them to this substance abuse. And media influence and glamorization. Look at the adverts on this alcohol and the things on television. They have made it so nice and attractive, and these adolescents will just see it and be interested, and they will start trying it. And then also, some of them want to feel and act older, and some of them want to challenge adults that I can even do it better than you. And some use it to relieve stress. And we have personality traits like poor impulse control or a high need for excitement. So the person will go in for that. And mental health conditions like depression or anxiety. And the consequence of these drugs, we have school failure, problems with family and other friends because they will try to isolate themselves from you. And then there's loss of interest in normal healthy activities. There's impaired memory. There's increased risk of contracting an infectious disease, especially those that shares the same needle for injecting some of these drugs. And there's risk of overdose death. Some can take overdose and it can kill them. And mental health problems too will result from doing these drugs. And alcohol is the harmful drinking among adolescents, and it's a major concern. The consumption of alcohol, even in small amounts, can impair judgment. If you take alcohol, you will behave in a way that you will later regret for doing that. Consumption of large quantities of alcohol in a short period of time can cause neurological or liver damage, which we are all aware of that. And then it reduces self-control and increase risky behavior such as unsafe sex or dangerous driving. Some people will take alcohol and then later they will go and have an unsafe person, and then some will not even know that they are having sex with a partner that they don't even like. They will wake up and they are in bed, and then they will be wondering how they got in there. It's under the influence of alcohol, and some too will drive recklessly. And this alcohol is a primary cause of injuries, including road traffic accidents, violence, especially by a partner. And it can also be a cause of premature death. Let's look at how we are going to manage alcohol. The first one is counseling, which is very important, and setting a minimum age for buying and consuming alcohol, because children are exposed to buying alcohol. Some of the adults will send these young ones to be buying, and they will be trying it on the way. Some too might think that they are drinking alcohol that is better, like Guinness, Club, and other things is the appetition, and the rest, that is not good. They are all not good. And then we should regulate how alcoholic drinks are targeted at the younger population. The adverts they put on TV easily influences the adolescents, and when they are having their program, these alcoholic companies will go and partner with them, support them, and be sharing alcohol to them, which is very bad. It should be stopped. And the last one for today is on drug use among adolescents, which is a global concern. And we know the drugs that are abused in the country. Drug control may focus on reducing drug demand, drug supply, or both. And we need to control drugs such as tobacco. Tobacco, when people use these drugs, it stains their fingers, their lips, and teeth. You will see that it has turned black, and it also causes bad breath. Smokers tend to be less fit and get short of breath more easily because their lungs is being affected. Tobacco also causes problems later in life. It can lead to cancer and heart diseases. Using certain drugs like cannabis, heroin, amphetamine, or cocaine can cause damage to the brain, liver, kidney, and lungs. And then injecting substances with shared needle can increase the likelihood of one getting HIV. And then substances such as tobacco and cocaine can induce dependency. Being dependent on these substances will lead to ability of people carrying out everyday activity, and can lead to tension with family members, friends, and others because they will not support that. Most people who develop dependence on substances do so during their adolescence. So they will start there and then eventually become addicted to that. So let us look at how we are going to manage substance abuse. We need to counsel the adolescents. It's very, very important. And then those that are already in that, we shouldn't judge them. We should try and then deal with each case as an individual case. We need to consider the developmental history of this person, the influence that is being exerted by the family or friends in doing this. And then we need to involve other professionals like psychologists, psychiatrists, occupational therapists, and creative therapists to help solve the problem. Substance abuse prevention is a process which attempts to limit the development of the problems associated with these psychoactive substances. So we need to help adolescents to effectively deal with peer pressures because most of the time it's their friends that influence them to do that. We need to give assistance for adolescents. We need to encourage them to seek help for mental illness because some of the mental illness can lead them into doing drugs. Then we need to encourage adolescents to keep a well-balanced life, and parents should also talk to their adolescents about dangers of using tobacco and the rest, because if you talk to your child, the child will not be influenced by peers. But there are times you will discipline, train your child well, but peer pressure will be so high and it will influence adolescents. And also, parents should make clear their expectation regarding adolescent behavior and be watchful for signs of substance abuse by their adolescents. So this is where I want to end our lecture on mental health conditions in adolescents. Next, we will be looking at other conditions. Any question? Any clarification?
Yes, ma'am.
Okay.
Considering the causes of mental health in adolescents, one thing I've currently observed among adolescents is ritualism, rituals
Oh, okay.
for many and for others, other reasons. Can we
Okay.
also classify that under mental health?
Okay, we can put it under the causes of mental health issue, because we have the top 5 courses, which has already been established. But apart from that, those spiritual things, it's been infused into the adolescents, so it can predispose them to mental health issues. So we will read around it and know where to classify that. Thank you.
Okay. Thank you, ma'am.
Any other?
Madam, please, me have a concern. Hello, madam.
Yes, please.
Please, concerning the slide that one of my colleagues spoke of, I listened to the feedback you've given us, and which is actually true. But today, like this, I think the link that was provided can only take 500 people. We have some of our colleagues.
Yes, please.
Yes, please. They want
There
to.
are
They can't
a lot
join.
of
I
us
was
waiting. Yeah.
Yes, so that is a problem.
Oh,
The network can take you out. I was there, then later somebody have to drop before I was able to join. So whatever you were teaching, I wasn't able to.
it's
Yeah.
unfortunate. I didn't know about that. It take up to 500. Wow. Oh, okay. It's unfortunate. Okay, then I will find time and then we will go over some of the salient points when we meet face to face, so that those that were not able to join will also hear about something. Okay. Any other concern? Okay. If there are no concern, thank you very much for your time. Have a nice day.
Thank you, madam.
Thank you, madam. Yeah.
Thank you, madam. God bless you.
Mr. Joe, when are we meeting again?
10:30 is break, so 10:30.
You should refer to the timetable.
Deborah Sawasa Akode, you have really disturbed today, Pa, and now that the class is over, you have muted yourself.
Now
Now that the class is over, huh? Did our village people send you? I don't know whether our village people send them. Then tell them we didn't see us, so wrong location or wrong address. I beg.